was a WITS UCL funded strategic partnership grant workshop between myself, Professor Pascaline Fru at WITS University, and the University of College London, Dr. Okoli. We also have partners from the UCL as well, Professor Hivi, and at WITS University we were supported by Professor Bregman from IDORI. The role of the workshop is capacity development, primarily capacity development for researchers of African origin to be able to produce research that will represent the African continent, because there's a limited availability of data for our own patient populations. When you start looking at data that's available for cancers, for example, you find that it's mostly our northern hemisphere counterparts, the Americas, and there's no representation for data that can represent our own patient and help us treat our patients better. There was a call at University College London for a grant, the UCL-WITS Strategic Partnership Grant. So I, from UCL, and Professor Pascaline Fru decided to partner on this grant to develop a workshop which aims to address the diversity gap in preclinical research through 3D modeling in Africa.
"2D is two-dimensional and 3D is three-dimensional. And it has to do with the fact that 2D, you can only see cells that are horizontally laid in length and breadth. Whereas when you talk about 3D, that has to do with length, breadth, you can see the depth or the height. The result from 2D has always been in error, especially when you are doing therapeutic experimentation, you have to do drug screening. But with 3D, because it is very close to the parent tissue, that gives you a better result than what we got from 2D. And especially we talk about 3D in respect of stem cells. Their auto-propagation, we have auto-renewal, and also they have auto-reorganization. They can organize themselves in a way that make them to look at the parent tissue. And another advantage that we have in 2D, 3D over 2D, has to do with the fact that if you are doing drug screening, for example, or you are trying to look at different modeling in sepsis, in cancer, or tumor microenvironment, you can be able to see them in a perspective that is being restricted in 2D. Although I must say that 2D has the advantage of being cost effective. And also if you are starting to do experiment, 2D is the best way to start. The scientific work you are doing is called bench. And the clinical work you are doing is called bedside. So there must be collaboration, there must be communication, there must be cooperation between the scientists and the clinicians. And why is it very important? It is important because it has to do with patient care. If you are going to be able to provide what we call evidence-based medical practice, then science must be at the forefront. But in a situation where we don't have collaboration between these two important components or spectrum, then it's going to be a big problem. So as a scientist, we will be able to communicate. For example, if I see some proteins that I feel that has to do with patients, I will communicate with the clinician that has seen this patient. And if the clinician, for example, feels that the patient is having fever, or a patient is having some sepsis, for example, they need to communicate back to the scientist that can you please help me check why this patient is having it? Maybe they can take a blood sample, they can take tissue from the patient, and that helps to be able to analyze why what we are seeing at the clinical level, then we want to compare it with what we see at the molecular level. And then with this, patient care will be optimized. And we can be able to have this collaboration and communication between these two important entities.
So my research specialty is neurodegeneration, and with a lot of these organoids, many of them are cancer-based, although there is a huge opportunity for also brain and central nervous system organoids as well. So I plan to use these three-dimensional cell cultures to model the brain and the blood-brain barrier better, to improve current therapies and to investigate new ones.
Well, I'm currently doing my first year in my master's degree, and this is directly related to my research as because I'm working with patient-derived breast cancer organoids, where I'm trying to investigate whether these models can be a suitable model for studying breast cancer metastasis. So this directly relates to my project in that sense.
So I found that there's enormous scope here in Africa for 3D culturing, and we still have a long ways to go. So my key takeaways is that we really do need to be building our capacity and building our skills to be able to fully represent Africa here using 3D cultures and 3D models.
My key takeaways from the workshop today and then the entirety of this week is that 3D cell culture has enormous potential, especially in African populations. With African populations being really underrepresented on the global stage, especially when it comes to cancer and as well neurodegeneration research, which is my specialty, these 3D cell cultures really can pave the way for an African-centric patient-derived organoids and treatment.